Welcome to the LDN Radio Show, brought to you by the LDN Research Trust. I'm your host, Linda L.C. Good. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low-dose naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us. Today I'd like to welcome my guest, Kristen Burris. Would you like to explain and tell us exactly who you are and what you do?
I would be more than happy to do that. It's a bit of an explanation. It's a mouthful for sure. I'm Kristen Burris. I am a licensed acupuncturist and a master herbalist in traditional Oriental medicine here in the United States.
Mm-hmm. So what is your practice? What do you do? Obviously, you said acupuncture and herbs, so yes. I get that.
Yes, I also, we have telemedicine here in the United States. My husband and I practice together at Eagle Acupuncture, but our telemedicine, I help people with complicated medical mysteries, pain management, and really I'm known for the most complex infertility cases in the United States. So I address women's health, pain management, chronic diseases, autoimmune diseases, and pain management.
Mm-hmm. So when a patient comes to you with a very complex condition that has been poorly diagnosed, where do you start? How do you find the root cause of their issues?
It's a really great question. And a lot of what we do is actually behind the scenes that our patients don't even quite see us doing prior to their appointment, researching, depending on the complexity of their case. And then, of course, in front of them, whether it's through telemedicine or in person, we are incredibly thorough. We really have training where we're able to use what we call integrative medicine, where we are able to look at their body from a Chinese medical perspective. So we're using patterns that were established literally thousands of years ago. And we're very investigative, even if it's something like a pain syndrome. We will be asking them about all systems, their GI tract, their digestive health, their emotional health, their it often seems as though we're being very nosy about things that they don't feel pertain to their medical condition that we're inquiring about, but we look at all those different systems and then piece together these patterns that have been established. And some of it, when we talk about it, we do educate our patients and we'll say, I'm about to speak Chinese, and you won't quite understand what I'm saying, but then we can translate that into some Western science terminology that people, even if they're not educated in science or medicine, can understand and relate to what we're piecing together. We also have background in looking at people's labs and being able to establish things like, an inflammatory condition, or look at pieces, because everybody has a creative process when it comes to medicine, right? That's why we call it a practice. Mm-hmm. And sometimes we can see holes, like it looks like you haven't been tested for this or this, and let's discuss with your doctor and maybe encourage them to look at certain things that may have been overlooked, whether it's a stealthy infection underlying their condition, or a rare blood clotting disorder, or maybe even checking for an autoimmune disease that hasn't even been looked at.
Mm-hmm. So once you've got all the information and you've looked at all the tests and everything, how do you go about setting out a roadmap to get them from where they are when they arrive to get them to their optimal health?
Yeah. And it is a roadmap for sure. As I'm sure you're so well aware of being, involved with so many different cases and so many different people's health, that it is complicated. And oftentimes what I like to do is start with a particular problem. Most of our patients may have up to 10 complaints, 10 concerns, health concerns. So we have to prioritize what that is. Is that anovulatory? Are you not ovulating? Is that pain management? Is that low back pain? Is that depression or anxiety? They'll say, well, it's all of it. And then we have to prioritize. The interesting piece, though, is even if we prioritize with the patient what they want to have heal first, their body is going to dictate what heals first. So we can try to heal certain areas first, but sometimes their mood will lift sooner than, let's say, their chronic pain, or their bowels will regulate. They'll stop having, blood or pus in their bowels with Crohn's or irritable bowel, before their fatigue debates. So we look at, oftentimes, depending on the severity of the syndrome or the disease process, how long they've had it, how desperate they feel with the longevity of how long they've been suffering. I like to put together a protocol with herbal medicine and supplements, and then if they're here locally as well, acupuncture. And then if it's a severe case, we're going to touch base within 6 weeks and analyze how things have changed for them. I really don't like to go longer than that because they're suffering so much. Why would I elongate that process? Usually within 6 weeks, we should have significant improvement. And if not, we're absolutely changing pretty much everything that we're doing. If we do have a 50% improvement, then I would adjust some of the things or reduce dosages or start pulling back on some things and see how the patient does in that way. We also layer this medicine with traditional herbal medicine, which is different than LDN, where we address certain aspects of your health. So someone could have what we call a blood stagnation issue, but they also could have phlegm accumulation in the body or a qi deficiency, an energy deficiency. And so we have to choose often where are we going to start? Are we going to increase their energy because they're just so exhausted? Are we going to move the blood to alleviate the pain? Are we going to dispel the dampness? Usually that could be like an infection or damp heat. So you have to prioritize and then peel away, as many people will describe it, like an onion, one layer at a time, and then change the protocol of what we're doing based on how the patient's body's responding.
Mm-hmm. And what about diet?
That's complicated. And when I first started practicing, because in traditional Chinese medicine, we absolutely are trained in many nutritional changes for the patient, for things that we can do everything from, reducing inflammatory conditions to increasing sperm counts to improving egg quality to, relieving irritable bowel syndrome to, all these things. And I used to put a lot of energy into that for every patient. And what I've discovered after practicing for 22 years is there's a small percentage of people who are motivated to change their diet. And so we do that as a separate option for patients to hire us to help them adjust their dietary either restrictions or adding things in, because you really have to be motivated. You have to be ready and wanting it. And so we are able to adjust. And again, traditional Chinese herbal medicine is different from Western science in that we're not so much looking at like the nutritional value, although we appreciate that. We're looking at the therapeutic value within the foods, and we look at temperatures of foods, we look at tastes of foods, because each of those things affect different organs. For instance, sour affects liver, salt, kidney, sweet, spleen. That's not something that you learn in like a Western traditional, dietitian, nutritional school. But it's critical. If a patient is freezing cold, you really want to balance them with warming foods and warming herbal medicine and even warming drugs. Even drugs have temperatures to get a therapeutic effect for the patient.
Mm-hmm. And I know people are very interested in herbs. So if you had to say which would, I know it's all individualized and it depends on each patient and what their condition is, but if you had to pick, 6 of the most common herbs that you use for people, what would they be?
Okay, I love this question, Linda. So I'm very passionate about this, and I appreciate you recognize that it is so individualized. And so one of the things that is particularly special about traditional Chinese herbal medicine is not only the longevity that we've had this medicine, but the complexity of the medicine. And so in our practice, other than Huang Qi, which is one, we really adamantly never, ever prescribe one herb at a time. We really believe in the synergy of the ingredients and balancing of what we call formulas or prescriptions for the patient's condition. So some of our formulas will have 4 herbs, some of them will have 24, based on the pattern of what we see happening in the patient. So the reason that our medicine is balanced in that way, it's very sophisticated. And you want to use herbal medicine in a way that doesn't cause side effects and doesn't cause the opposite pattern to occur in an extreme fashion. So that's where we go into yin and yang, that balance. So it's very important, for instance, if you're moving blood and the patient is cold, you also must warm the internal environment in order to move that blood. Whereas if the patient has excessive heat in their body, inflammatory conditions, red face, high blood pressure, we get into all these different patterns, you must cool the blood in order to stop the bleeding. So it's really a sophisticated way where we balance the herbs. I often will take that description down and describe that as the cookie ingredients. So if you were to come to my home and I were to offer you a dessert and I gave you a tablespoon of sugar in your mouth, it's not really that pleasant. It's too sweet. It's not really a dessert. You don't really enjoy it, and you might even want to spit it out. So that's an extreme flavor, not balanced. Whereas if I took that sugar and I balanced it with almond flour and some baking soda and some salt and some chocolate chips and some oats, now we've got bitter with sweet, with warm, with all mixed together. And the balance and the harmony of that is a delicious cookie. So that's the sophistication of traditional Chinese herbal medicine that is very able to create synergy and harmony and health within the patient.
Before I was diagnosed with MS, sorry to interrupt you.
No.
I saw a Chinese herbalist who did acupuncture as well. And he had his consulting room, and then he had what I guess would be like a dispensary. He had jars and bottles of all these dried herbs.
Oh, yes.
So he would have a bowl and he would take a bit of this and a bit of that and mix it all up. And I had to put it in a saucepan with however much water and bring it to the boil, simmer it, and then drain it and keep it in the fridge and drink. And it was so difficult to drink.
Yes.
You could put honey with it, I believe. But I can remember going, well, this is just awful.
Terrible.
Absolutely terrible. Is that what you still do, or is it different now?
So your questions are just so fabulous, Linda. So when I was in Chinese medical school, it was my husband and I both, it was one of our favorite aspects of treating patients within the clinic at our college. And that is what you call a raw herbal pharmacy. And it is incredible. I mean, you walk in, that pungent smell, you can see the different herbs and colors and tastes. And one of the reasons that they would do that at our for our training is to really grasp what you're prescribing, to really understand the essence. You can smell if something's bitter, you can taste if it's bitter, you can see if it's sweet, you really get the essence of, what 15 grams looks like in one herb as opposed to another, due to the density and the heaviness. And it really gets you in touch with the medicine on a deeper level. And we too would prescribe those for our patients, 25 years ago, and make them boil it up in a clay pot, and it made their whole house stink. And if you weren't raised with this medicine, it really was a stretch. And I was so proud of these patients because they would do it. It was really, I've done it, and it's intense, and it's, garden mud sludge that you would have to choke down, and it was desperate. So no, we have many different forms now. We have granules, which is probably the closest that you would get to a raw herbal pharmacy. So it's powdered form. You mix it in warm water and you chug it down. And I forewarn my patients and I give them options. I'm like, we can do this approach, but I am going to forewarn you. It tastes like, bitter garden dirt. And so you have to be motivated, but you won't have to take so many pills. That's another thing with the Chinese herbal medicine. It's incredibly sophisticated and balanced and safe, yet you have to take quite a few pills in order to have a therapeutic effect throughout the day. So they have to weigh, are they okay with swallowing pills, or would they rather swallow, this liquid garden dirt? But they just have to mix it in warm water. Another option is liquid tinctures. And then a third option is pill form. So I would say the majority of my patients, near and far, anywhere throughout the United States, are consuming pill form. They'd rather just do a handful of pills. I often prescribe twice a day, not 3 times a day, because that third dose is challenging to get in the midday. People forget, or it's hard with work, or so on and so forth. And so it's much easier. Compliance is much higher. So that's how we address that in the United States, because we were not raised with this medicine, and we're not familiar with those flavors and that taste.
So if you had the crystals, would it be once a day, or would that still be twice?
I really prefer twice a day. I really do, because if a patient cannot be compliant, we can try once a day and see how they do, but it's not time released in the way a drug in a capsule may be. So you want to have it in your body as frequently as you can, so that you can create that harmony and that balance and then heal from.
Does it get into your system quicker?
I think it does. I think, you just don't have to break down the capsule in your digestive tract. So, if we're looking at someone who has compromised digestive problems with SIBO or reflux, or they just know that they don't absorb things well, we really do encourage using the granules in the liquid form if they're willing to.
And I'm sorry, I interrupted you earlier.
No, that's okay. I'm not sure. That's all right. I'm not sure where I was going with.
Yeah. Okay. So with your acupuncture,
yes,
explain more about that for people who can travel to you.
In what way, Linda? What would you like to know? There's so much to share.
Yes, just if somebody doesn't know anything about acupuncture, if you could just give us an overview.
Oh, it's so, this overview, I probably, almost every new patient, the question we get, or I get, is, how does this work? And I love it. I mean, I remember being there 30 years ago when I first was introduced to this medicine, because I was very skeptical that it would help me. And I often preface it with my patient saying, it's not that I won't answer your question. It's just that, imagine you're asking your doctor, you go in and you say, in a brief summary, in 1 to 3 lines, describe to me, how does Western medicine work? And they would go, well, wow, I see a patient, they tell me their problem, I prescribe a drug, or I give them a surgery. I mean, it's very difficult to break down a whole system of medicine in a few sentences. Then we're also challenged in our world that we don't understand the language of Jing, Qi, Sanjiao. These terms don't translate well into our American language, our English language. And so trying to break that down and say, well, we have these 12 meridians and you put in an acupuncture needle and it has a therapeutic effect, eyes roll back. They don't know what's a meridian, right? But
very basically.
Very basic is,
I've had needles around my eyes and things.
Yes.
And some people are petrified of needles, as am I. But the needles are very, very fine. And when they go in, you don't feel, it's not like having an injection or anything like that. The needle just goes in and you're hardly aware of it going in the skin.
Yes. It's unfortunate that we have to call them needles, because we all have an aversion to needles. What I tell my patients is I have incredibly gentle needle technique. My style is more Japanese than Chinese. And we use the most expensive and refined needles there are on the market, which makes a difference. And most of my patients fall asleep during their treatment. And most patients start out terrified of the concept of even trying acupuncture. We also let them know that we can needle a baby and a baby doesn't cry, and babies cry over everything. So it's incredibly relaxing. The briefest of explanations is acupuncture can modulate the neuroendocrine immune network and also can release endorphins and enkephalins in the body for pain relief. I mean, that's one of many. We also can prove through different, blood serum or MRIs from a scientific perspective that we can tap into the hypothalamus pituitary ovarian axis. We also can prove that we can reduce the inflammatory and cytokine storm in the body. We're starting to be able to use scientific language to describe how acupuncture works. They've even done beautiful studies where they put people into an MRI and they'll stimulate a point down on their foot that's for eye disease, and like the visual cortex will light up in their brain. So we're starting to be able to describe it from a Western perspective so people can say, oh, that makes sense. You give me acupuncture and I have more, happy hormones throughout my body. And they say, okay, I get that. And the earth medicine is the gut brain connection, immune connection, the hormone connection that we're all talking about these days. We're like, well, we've known about that for 2,000 years, but I'm glad we're getting to promote that out into the world now. Again, when we start to describe, well, there's either stagnation in a meridian or there's chi deficiency, we lose our English speaking population. We just don't have a good translation for that. So the mastery is we understand it. So we understand whether you've got blood stasis or a yin deficiency or a yang excess or a combination of all of them, or damp heat. There's so many different patterns. That's our expertise and that's our job. And the patient's job is just to lie down and relax.
Mm-hmm. Do you use cups? The Chinese doctor I saw would put in my back, he'd put several needles and then he'd get like a glass dome, I guess, and he would burn the oxygen out and then stick it over the needle so it would pull. I can't tell you exactly. He must have explained to me what he was doing.
Yes.
I was relaxing.
That's just called cupping. And so it's very simple and used often to alleviate, as I mentioned before, blood stasis, stagnation. You typically want to use it in excess conditions on the patient. And so you're right. You just take a flame and you suck out all the oxygen and quickly put it on the body. And I mean, the best way to describe it is maybe like a little bit of a reverse massage, maybe. Some people absolutely love that sensation. It brings them immense relief. Many people will see those perfect little circles down the back, and the rise of Sha, what we call Sha, is that purple or reddish coloring will come up, and it looks like a bruise, but there was no impact, there was no contusion. So it's an interesting phenomenon. Typically, the more severe, what we call the blood stasis or the stagnation, the more dramatic that coloring, that discoloration will be, and it will last longer.
Okay. Interesting. Yeah. Very interesting.
Yes.
Okay, so we have a few minutes left. What else would you like to tell us?
Well, one of the things I am so grateful for really is you and your trust, the trust and the expansion and education of LDN. I feel that it's one of those drugs that really is almost in a, how can I say this? The mechanisms in which acupuncture have been proven to work are very similar to the mechanisms that they are discovering in low dose naltrexone and how it works. And I find that really fascinating in terms of the immunomodulating and the inflammatory modulating aspects. And I've never seen or read about any other drug that mimics and behaves in the body in such a similar fashion. And so I find that patients who respond very well to acupuncture, and it's been life-changing for them, patients with MS, Crohn's, irritable bowel, infertility, rheumatoid arthritis, Hashimoto's, they respond incredibly well to low-dose naltrexone. It's not a drug I can prescribe or recommend even in this country. However, I can educate my patients to go to the trust, research, read your book, ask their physician, really enlighten them about the possibilities. Even patients who are attempting to fight cancers, that tends to be a more touchy subject, at least in the United States. I don't know if that's true in the UK, where we need to be able to describe how we help patients who have cancer in the United States in a way that doesn't sound curative, like it's not a cure, but we absolutely can improve the quality of their life, and even through labs and other methods like MRIs prove like the reduction in size of tumors, or even project the possibility of living longer. Anyways, you have to be rather careful with your language and how you describe what your expectations are. But it just has been fascinating to me to see the brilliance of a drug that is so safe, so well tolerated, and really has such a wide scope of helping very difficult diseases.
So for people who are watching or listening, because it goes as a video and as audio, if people are on LDN but they would like to consult with you for the Chinese herbal side of it,
yes,
you do the whole of the US, is that correct?
Yes.
Okay.
Yes.
So would you like to give people your website address so they can go and find you?
Yes, I actually have two. One is called Eagle Acupuncture. So that's like the bird, EAGLE. And then acupuncture, many people misspell. So it's ACUPUNCTURE.com. And that is for patients who have medical mysteries, myalgic encephalomyelitis, chronic fatigue, Crohn's, depression, anxiety, rheumatoid arthritis, autoimmune conditions. You can go on the website, you can see the multitude of things that we treat, pain syndromes. We take the most difficult infertility cases for male and female, as I had described before. For those patients and those who also sadly have had habitual miscarriage, we direct them to our site that is www.yourinfertilityspecialist.com. And it's a little different. So that's YOUR infertility, INFERTI. Oh my gosh, really? Infertility. INFERTILITY specialist, SPECLIAST. Wow.com. I've even eaten today. So those are two different sites.
And where are you based?
I'm based in Idaho. Practiced half my career in San Diego, California, and now we're right outside of the capital of Idaho called Boise. So we're in Eagle, hence eagleacupuncture.com.
Well, it was such a pleasure talking to you, and thank you very much for sharing your experience with us.
Well, thank you so much for having me. I really appreciate it, and thank you for all the work you do for so many people throughout the world. We really appreciate all of your hard work and effort. It does not go unnoticed, so thank you.
Any questions or comments you may have, please email me, Linda, LINDA, @ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.